Bienvenidos al Medical Spanish Podcast. Soy la doctora Molly Merton. Through this podcast, I provide interactive audio lessons that teach practical Spanish for healthcare and elsewhere. Feliz Año Nuevo! It's that time of year again. It's the flu season and there are a lot of upper respiratory infections going around. So, in this audio lesson, we are going to learn how to express symptoms of the flu in Spanish. If you're a healthcare provider, you know that the flu causes symptoms of the common cold in addition to a high fever, diffuse body aches, and fatigue. First, you will hear a clinical dialogue, where señora Garcia presents to the clinic with a terrible cold. She is quite worried as she is 7 months pregnant and many of the children at the daycare where she works have recently come down with the flu. For this clinical dialogue, I am joined by online Spanish teacher Ángel Baena, who has just completed his training as an ICU nurse. Felicitaciones, Ángel! Following the clinical dialogue, we will practice expressing those symptoms of the flu which are also caused by the common cold. You'll learn how to say cold, runny nose, stuffy nose, sore throat, and cough. ¿Listos? Empecemos.
Hola, señora García. ¿Cómo le va el día de hoy? ¿Qué le trae a la clínica?
Me siento muy mal, doctor. Tengo un resfriado terrible y estoy embarazada. Por eso vine a la clínica.
¿Cuántos meses de embarazo tiene?
Tengo 7 meses. Es mi primer embarazo. Por lo tanto, estoy muy preocupada.
No se preocupe, vamos a revisarla. ¿Cuándo empezó a sentirse mal?
Anoche, cuando me dio una fiebre de 39 grados. Sigo sintiéndome afiebrada y siento todo mi cuerpo dolorido. Tengo moqueo y dolor de cabeza.
¿Le duele la garganta?
Sí, me duele al tragar y me siento muy fatigada.
¿Tiene tos?
Sí, esta mañana empecé a toser.
Ok. ¿Tiene flemas?
No, es una tos seca.
¿Le falta el aire?
No, pero me cuesta trabajo respirar por tener la nariz tapada.
¿Ha tenido contacto con alguien que esté contagiado de la gripe?
Sí, doctor. Trabajo en una guardería y muchos niños acaban de enfermarse de la gripe.
¿Se vacunó contra la gripe este año?
Sí, doctor. Hace 5 días me vacunaron en el trabajo. ¿Puede ser por la vacuna que me enfermé? Okay, let's review señora Garcia's symptoms, focusing on symptoms typical of the common cold. Do you remember how she said, "I have a terrible cold"? Tengo un resfriado terrible. Another way to say I have a cold is estoy resfriada. And if you're a man, how would you say this?
Estoy resfriado.
Do you remember how she said I have a runny nose? Tengo moqueo. You will also hear tengo moqueo nasal. So moqueo comes from the word for snot or mucus, los mocos. So try that one again. I have a runny nose. Tengo moqueo. How about I have a sore throat?
Tengo dolor de garganta.
How did the doctor ask? Does your throat hurt?
¿Le duele la garganta?
Do you remember how señora Garcia replied, "It hurts to swallow"? Me duele al tragar. So here she used a combined with el al tragar, to say upon or when swallowing. So try that again. It hurts to swallow.
Me duele al tragar.
How did the doctor ask? Do you have a cough?
¿Tiene tos?
So how do you say the verb, to cough?
Toser.
Using usted, how would you ask, are you coughing a lot?
¿Está tosiendo mucho?
How would you say, I cough a lot? Toso mucho. Now, I have heard people say tueso mucho, but it's not a stem-changing verb. The O remains an O. So how would you say, I cough a lot?
Toso mucho.
And how did the doctor ask, are you bringing up phlegm?
¿Tiene flemas?
And then señora Garcia replies, no, it's a dry cough. No, es una tos seca. So, tos is a feminine noun. Try that one again. It's a dry cough.
Es una tos seca.
Finally, how did señora Garcia say stuffy nose? La nariz tapada. So how would you say, I have a stuffy nose?
Tengo la nariz tapada.
Y eso es todo por hoy. If you want to go further and master all the key vocabulary and phrases from this dialogue, sign up for a premium membership at docmolly.com. You'll get access to over 200 interactive audio lessons, including full transcripts so that you can read along as you listen. In the premium lessons, we review all the clinical dialogues and interviews you hear in the free Medical Spanish podcast, as well as additional clinical dialogues. For example, for today's lesson, there is a follow-up dialogue where the doctor explains that Señora Garcia did not get sick from the vaccine, but rather from her exposure to children with the flu at the daycare where she works. He also explains the treatment plan. Y ya está. Feliz Año Nuevo. I'll be back soon with listener-requested topics. We'll be covering COPD, vertigo, and much more. Hasta la próxima! This is a production of DocMolly.com, where you will find interactive audio lessons that teach Spanish for healthcare and elsewhere. The lessons offered at DocMolly.com are solely for learning Spanish. They are not intended to teach medicine or provide medical advice.